Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, November 2, 2021. I'm really pleased to be joined by a guest. This is the relatively new CEO of Chicago Public Schools, Pedro Martinez. Welcome and thanks for coming.
Thank you, Dr. Arwady.
We've been getting a whole lot of questions in about kids and vaccines, and so wanted to really use the opportunity to talk in some detail about what those plans are. Let CEO Martinez talk a little bit about those details. So as always, you can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. We're going to dive in and show you some data and answer a few of the questions just that we've been getting repeatedly right up top. So let's go ahead to the dashboard, chi.gov/COVID-, as always. And if you take a look, we are seeing just a little bit of an uptick in our numbers. So we're averaging 312 cases per day, up about 8% from a week ago. And if you look at testing is actually down a little bit. So it's not just that it's a change in testing that's driving that. It actually is just a little bit of an increase. Hospitalizations still look good. You can see we're averaging about 13 Chicagoans each day getting newly hospitalized with COVID, down from 18 a week ago. We're still averaging 3 to 4 deaths a day, almost all of those in people who are unvaccinated. 99% of our COVID deaths in the city of Chicago have been in people who are unvaccinated. Vaccination numbers are looking good. You see that nice uptick there, almost 9,000 a day. Some of those are boosters for sure, but we've still got a few thousand people every day saying today's the day I want to get my first dose. And our positivity is also just ticking a tiny bit up, 1.7%. Still under 2%, it's good, but all consistent with just, some flattening. And let's show you a little bit of additional data, and then we'll go from there. So first of all, for the update to the travel advisory, as of today, South Carolina, Texas, and the Virgin Islands are all coming off the travel advisory. So just a reminder, when a state has been under that 15 cases per 100,000 per day for 2 weeks, the same cutoff we've been using the whole time, they come off that travel advisory. California, though, and Mississippi also on the increase, and both on that travel advisory. So this only applies to people who are unvaccinated. We were getting some more questions in about that. Amanda Ybarra on Facebook said, do we have to quarantine when traveling if a state we're traveling to is off the travel advisory? If the state is off the travel advisory, meaning it's yellow, there is no quarantine, even for people who are unvaccinated. And if you're vaccinated, there's no quarantine or testing requirement to travel anywhere. If we look at our risk matrix here, you can see in addition to the little bit of an uptick in the cases and the positivity, we are also seeing a little bit of an uptick in hospital, people in the both non-ICU and ICU with COVID. Still in the lower risk range, but that's where we are. We had a good milestone. 3 out of 4 Chicagoans over the age of 12 have gotten a COVID vaccine, so nice to have that third star filled in there. And a reminder that we're coming up on some of the deadlines for vaccination in time for the holidays. So November 11th is your deadline to get a single dose of J&J if you want to be vaccinated in time for Thanksgiving, fully vaccinated. November 14th for Hanukkah. And then if you want to get Moderna, for example, November 13th is when you got to get your first dose to be fully vaccinated in time for Christmas. And November 14th would be the first dose for Kwanzaa. So please plan ahead. Obviously, we are looking forward to being able to gather in ways that it was really hard to do last year, but those dates can sneak up on you, so please get vaccinated. Quick booster reminder, because lots of questions about this too. Anybody who got a Pfizer or Moderna vaccine, we strongly recommend you should get a booster 6 months or more after your second dose, anybody over 65 and anybody over 50 with an underlying medical condition. And for anybody who got Pfizer or Moderna and is younger than that, you may get a booster, again 6 months later, for anybody over the age of 18 that's got an underlying medical condition or working or living in a higher risk setting. So we're seeing a lot of booster uptake, a little more than the national average, which is good, but want to make sure we're keeping on that. And then for those who received a J&J vaccine, strongly recommend that you should get a booster 2 months or more after the first dose for anybody 18 and older. So hopefully that handles some of the booster questions. And now to the children focus. So we did share together some of the details about plans for children. Chi.gov/COVIDVax has a lot of information. We'll be putting even more up there. There are more than 80 pediatric offices that will have it available. Many pharmacies all over the city, all of the Walgreens, the CVS's, et cetera. The children's hospitals are doing things. Schools, which we'll hear about, are doing things. CDPH is doing weekend vaccination clinics Saturdays and Sundays starting the 13th and 14th at the city colleges all over Chicago, really running into January, except skipping the weekend of Thanksgiving and other events. Let's hit some of these questions right off the bat, too. Is the Pfizer vaccine that's being evaluated for younger children the exact same vaccine that teenagers and adults received? It is the exact same ingredients. It is the exact same time frame. So yes, your child in that 5 to 11 age group, just like the older kids and adults, needs 2 doses 3 weeks apart, and you do need to get both. But importantly, it is only 1/3 of the dose. So smaller body mass for the kids, but you get the same level of protection. The good news is less likely to have side effects. So that's good. Smaller needles. There are needles that are being distributed specifically for pediatric providers, and because of that smaller dose, there's separate child vaccine vials. Other than that, everything is pretty similar to what we saw for adults. The vaccine remains totally free for kids. There's no insurance requirement, no identification requirement, no doctor's order required. You can walk into a pharmacy. It doesn't have to be a place that you've necessarily gone repeatedly for your care. Just like adults, COVID vaccine can be given at the same time as other vaccines. So you can get the flu shot done at the same time, other childhood vaccines, no problem. Plenty of availability. Make an appointment if you can, just to help, but in many cases we'll be able to take walk-ins. And down the line, we will make availability for at home for younger kids. In the meantime, if there's a 5 to 11-year-old who's in the family or in the household where we're vaccinating, we're happy to do that. Plenty of vaccine available. There's about 210,000 kids in Chicago between 5 and 11. We're getting almost 100,000 doses that first week. So we are not seeing the Hunger Games. And I'm going to hand it over to CEO Martinez to talk through a little bit of the CPS data, and then we'll get to your questions.
Thank you, Dr. Arwady. So one of the things we're seeing is we continue to see overall cases very low. In fact, we have not bumped over 200 cases per week for students. Keep in mind, community, that we have 330,000 children coming to school. So on such a large base, we're not seeing staff cases rise either. And overall, we right now you can see the number of children that were quarantined as of today. We are right now working, and I'll have more details next week, about piloting a program, and I'm going to ask Dr. Arwady and our health staff to endorse it. So we'll present it to them that we will pilot in the month of November for a test to stay program, so that parents will be able to allow us to test their children instead of their children being quarantined. And this will be only children that would be exposed, but more details to come next week. Our COVID testing ramp up continues. So we hit a record of 23,000 tests. Keep in mind, it was just a month ago. I just started month 2. This is day 2 of month 2. It was just a month ago that we were less than 10,000 tests per week. We're now over 23,000. Our capacity, even as of yesterday, we're starting to be close to 30,000 per week, and so that continues to ramp up. And what's exciting about our staff vaccination efforts, almost 90% of our staff are vaccinated. Right now, 89.1 are fully vaccinated, but we have several hundred that are waiting for their second shot. And the one thing that we continue to work on is our students. Right now, 47% are fully vaccinated as of today. We do have, when we count students that have their first shot, we're over 56%, but still, we'd like to raise that number because we're still behind the rest of the city.
And that's of the 12 to 17-year-olds, right?
12 to 17-year-olds, yeah. Yep. And then, of course, we continue to have, we provide access to any 12-year-old or any family member that wants to get vaccinated. We have 4 regional vaccination clinics. We also have mobile opportunities where we can actually provide those. We have over 15 school-based health centers and school-based events. So on our website, and so this is for 12 and up, but of course 5 to 11 is coming, so we're very excited. And in fact, if you go to our website, You can actually see multiple sites on the map. If you just take your mouse and overlay it, you can actually see the days and the hours that they're open. So please, I encourage all of our community members to take advantage of that. And again, I just look forward to partnering with Dr. Arwady, because to have this much vaccine coming in for 5 to 11-year-olds, I just think it's exciting, especially for myself as a parent of an 11-year-old and 5-year-old.
All right, great. So go ahead, we'll start diving into questions. In the meantime, happy second day of your second month. Can I ask you, in that first month, what has been some of your focus? What has surprised you? I mean, it's such a time of year to be kind of coming in and
yeah, Dr. Arwady. So first of all, I mean, I'm just excited to be back home.
Yeah.
I mean, Chicago was my hometown, and to be able to come to the district where I went to school, I worked here for a number of years during the 2003 to 2009 period. Been in schools almost every day. What I love is just seeing teachers and students who are happy to be in school in person. I see our safety procedures in place. And really for me, the first focus really has been to try to reduce the anxiety.
Yeah.
When I came in, and Dr. Arwady was a huge support for me, there was just so much anxiety because we were still building up our COVID testing, we were still building up our contact tracing. So anxiety was very high when I started at the end of September. I feel like we turned the corner. And so now there's less anxiety. And so now really for me, it's going to be exciting to just partner with the Department of Health and really help our students ramp up on vaccines, because that's going to be such a difference as we minimize quarantine. We can maximize children being in classrooms and stability. So that's really my main focus, as well as troubleshooting many things that when you read the media, there's several things that I'm still troubleshooting, but I'm excited. I'm excited about where we're going and the fact that we're on the other side hopefully of this pandemic.
Absolutely. All right, good. I'll tell you, I was talking to your team this morning, and really pleased to hear a lot of the plans, some more details around those plans. So they were telling me, I think there's 83 schools that are already scheduled to have vaccine clinics at the school just, over the next couple of months, which is great, in addition to those larger sites. So it's really good to see. We're getting a number of people writing in on both Twitter and Facebook asking all versions of the same question. So let's take this one. Activist Mama from Twitter, Courtney Ritzema on Facebook, and Kathy Powers from Facebook are all asking versions of a question. Why aren't we using schools as mass vaccination sites? Activist Mama says, why are the schools not being used as mass vaccination sites for children when we know this is the most effective way to get the most shots in arms? So similar questions from a number of people there. Do you want to start a little bit with that, and I'll chime in?
Yeah, so Dr. Arwady, I mean, and I say this even myself as a parent of an 11-year-old and 5-year-old. Many of our parents will go to the pediatricians. I know that's what my wife is going to do. And so that, I think, will always be a primary source for vaccines. And look, that's where you have the most trusted individuals, right? Now, our clinics, though, are going to be open. In fact, right now what I'm working on is a plan to have, like Dr. Arwady said, multiple events throughout the next few months. And so right now, the biggest challenge I've had is even though we've been open for 12-year-olds and up, we have not, we're below capacity. And so we have plenty of vaccine, but we're not getting as many children that want to come. So where I need help from parents is talk to other parents. We're doing student videos right now to encourage our 12-year-olds and up to be vaccinated. So I love it. There's student leaders from multiple high schools. But I need help from parents to encourage other parents, whether if they need more information, they can reach out to my team. I know they can reach out to your team, Dr. Arwady. But I think that's the biggest challenge is many of our neighbors are just not informed. And you have, for example, shared some great facts today about how safe the vaccines are, how the doses are smaller. Those are the things as a parent that I want to know for my 2 children, that the needles are smaller because we know my children don't like the shots at all.
Exactly.
But I think where we need help is getting the word out to parents.
Yeah, sounds good. And I'll just chime in a little bit on this sort of mass vaccination idea. So we see COVID vaccination as an opportunity also to make sure that children are connected to a pediatric provider. So we care about this beyond just getting them vaccinated for COVID. And not everybody knows, we talked about this a little bit last week, not everybody knows every child is eligible for insurance, regardless of status, regardless of income, regardless of immigration status, any of this, partly because children tend to not have a whole lot of expenses, compared to older adults for their health. And so there is no reason why any child in Chicago should not be able to access really good pediatric health care, and we have a lot of it available. But we've seen that vaccine brings people in ways, and we really most want to make sure that families are getting connected to a provider, because it's not just about the COVID vaccine. It's about, are you up to date with your other things? Are you getting the other guidance, all of that? And related to the mass vaccination, so the way I'm thinking about it anyway is that probably about a third of our parents are really excited to have their children vaccinated. And I know you fall in that category, and I fall in that category. And for those people, there is plenty of vaccine available outside of school settings, and we prefer people to go to the healthcare settings for a whole host of reasons. We are also, the city is doing these mass, quote, vaccination clinics, like I said, every Saturday and Sunday, starting the 13th and 14th, going all the way through January, recognizing those weekends help fill in gaps for working families. Those are not just for kids, those are for adults, anybody in the community. And those offer kind of a large opportunity where you're not disrupting what else might be going on. And we've really appreciated the partnership with city colleges. They've been amazing all the way through this. And that's we know there's public transportation available, et cetera. So those are sort of, quote, mass vaccination sites. I see the schools and the way CPS and other schools are thinking about this as helping to fill in some of those gaps. So where there are the people who are not as much going to go out of the way to go and get a vaccine, really working to build confidence within the school, break down barriers, opportunities for parents to consent to potentially having their child vaccinated at school if they're interested in that. There's a lot of pieces there. We also, you're in a community there where there can be more trust and more conversation. So they're a really critical part of the schedule, but different from early on when we were really worried about how much vaccine was going to be here. There's plenty of vaccine. So this is more about decreasing barriers, and that's part of how we think about it.
And Dr. White, the other thing I would add is, so many of our parents, because of their work schedule, sometimes they don't have the flexibility. So schools are a great setting for those parents.
Yes.
And again, but we should be a backstop, because and even in our health clinics, they're managed by by community providers. So it's not our staff that are managing it. And so again, we can give you access to health services, but as Dr. Awadi said, it's really more than just a vaccine. Yeah. It's more important even to our children to be connected to pediatricians and to doctors.
Okay, good. Melanie Taylor on Facebook is just following up here. Will the mass vax clinics be in time for kids to be vaccinated by Christmas? Yes. So if you were paying attention to some of those timelines, Pfizer is the vaccine that children can get. That's true for 5 to 11-year-olds. That's true to 12 to 17-year-olds. For Pfizer to have gotten both of your doses and have the 2-week waiting period, you got to get that first one by November 20th. So you've got a few weeks to be able to have your kids fully vaccinated. And again, there's going to be plenty of vaccine available, and I would love to see people really think about that and do that. So both of the we'll have multiple opportunities. Some of the children's hospitals are also standing up some weekend and off-hours clinics. So yeah, that's your deadline for Christmas.
Dr. White, do you feel comfortable saying when you think the 5 to 11-year-old vaccines could be available?
So yeah, so this afternoon we are expecting the Advisory Committee on Immunization Practices, which is the external advisory group to the CDC, to actually take a vote on the Pfizer vaccine for 5 to 11-year-olds. It was given that authorization by the FDA. So assuming that they give the go-ahead, they're the ones who put some of those details on around the timing and et cetera. Then the CDC would formally give its guidance. That may happen as soon as tomorrow. I don't know for sure. And then when that happens, assuming that what we expect to happen, is available, there already is vaccine shipping to Chicago. We've been following, some of our locations. Even yesterday, we're getting what we call the ancillary materials. So you get the needles and the paperwork. All of that sort of comes when some of that started to arrive. We expect some of the first vaccine doses to arrive sort of tomorrow, the next day, and I think it's likely that by this weekend, if everything goes as planned, we'll probably maybe as soon as Friday, maybe even Thursday, we may start vaccinating. And, a lot of it will probably be more next week, realistically. But yeah, we're excited and we're very ready and looking forward to it.
That is exciting.
Absolutely. All right. So a couple questions here about testing. So Courtney Ritzema on Facebook says, when will CPS make good on the promise that 100% of students will be tested weekly? I'm going to start on that one, and then I'll have you chime in. So Courtney, I just want to be really clear that there is not a goal anywhere in the country. It's not the recommendation of CDC. It's not the recommendation of the health department to test 100% of students weekly. That is just not a goal anywhere for a few reasons. Number one, where people are vaccinated, that risk is really very low. So the CDC, health departments everywhere, in the absence of symptoms, in the absence of other issues, we do not recommend testing people who are vaccinated. We want to really make sure that we're focusing that screening testing. Again, remember, this is testing for people who don't have symptoms on the folks. The goal is to make sure you're not missing a situation. And so, CDC has said, for example, you should try to be doing 10% of the unvaccinated people in a school setting each week. And ideally, you're doing that in a random way, and you're actually each week sort of, looking across the system. So, I'll have you chime in here, but our top priority was get into all the schools, because we want to make sure that that's available. Obviously, if you're concerned about cases, outbreaks, et cetera, there's additional testing that comes. But otherwise, it's about being present, doing that surveillance testing. And if you see problems, then we double down some more. The other thing is we don't test children without parental consent. So do you want to chime in on some more on that?
Absolutely. And so what's interesting right now, we have about 29,000 parents have consented to have their children tested. We are, as Dr. Awadi said, we are now at all schools. We're very close this week to getting to that level of capacity. I believe definitely before Thanksgiving, we'll be at a capacity well over 30,000, close to where our goal is to be at 40,000. At that point, we would be able to test any child that's consented as well as any unvaccinated staff. And then to Dr. Awadi's point, what I'm going to be looking at is, do we have enough children being tested at every school so that we have enough of a representative sample to know that, because you don't need to have every child tested at every school, we just need enough of a sample to know that the risk is very low at that school. In our cases so far, remember, cases are reported from all sources.
Exactly.
Home tests, doctors, or from our tests we do at schools. Our cases for students have not went over 200 per week in almost the last month. And so our cases continue to be very, very low. So again, for us, that just tells me that the schools are very safe. And then we'll be using more of our COVID testing, again, more information to come next week, to really look at how we minimize quarantine. Because the biggest concern I'm hearing from parents right now is we're still quarantining too many children. That's why I want to pilot a test to stay program.
Yeah, and let me kind of put a finer point on that. For me, obviously, the most important reason for kids to get vaccinated is to help protect them against COVID, and to help, protect the people that they are in close touch with, their families, older people who may be vulnerable. However, just a little bit behind that is, in the same way that all of the public health guidance says there's no need to do routine asymptomatic testing for unvaccinated people, there is also no need or indication to quarantine fully vaccinated people, even if they are exposed to COVID, as long as they don't have symptoms. So in schools, this is especially important. If you're thinking, should I get my 10-year-old vaccinated? First, for their health, it's safe, yes. But secondly, if they're vaccinated, even if there's a child in their classroom, who has COVID, as long as they don't have symptoms, et cetera, they don't have to quarantine. We don't have to interrupt, interrupt school there. Because again, the vaccine no vaccine is 100% protective, but it is so good at really limiting that risk. That you also, it's one of the reasons we're seeing many more elementary schools needing to do a lot of quarantine as opposed to the high schools. Even if half your kids are vaccinated and nearly all of your staff are vaccinated, you've significantly decreased the amount of quarantine there. So.
Well, and Dr. Awadi, one of the concerns I have is right now, because of safety protocols, any child who has any symptoms that resemble a cold, we have to pull them out of the classroom. My concern is we're getting into the holidays, we're going to see more of this, especially as we get into the winter months of Chicago. So the more children that are vaccinated, the more that we can minimize any of those challenges of pulling children out of classrooms. So again, just to emphasize your point, it's so important right now that they're vaccinated. And I'm more than confident we'll have the COVID testing available to do the test to stay procedures, but it's still not superior to having your children vaccinated.
Yeah, so there's a question here about test to stay. At Liz222 on Twitter says, I was on a webinar this week through Johns Hopkins regarding using rapid antigen tests for school test to stay programs, other return to school. Is this what you're looking at? Is this an option? It seems like Johns Hopkins was recommending this.
Absolutely. So I actually want to look at both using a combination of PCR and rapid test. The PCR is the most sensitive test, it's the gold standard, and that one gives me the most assurance that a child's not positive. The rapid tests are also a great follow-up. So I'm going to be working on Dr. Awadi, our health professional team. We're going to pilot a program this month, and what I want to commit to my parents is that there'll be personal phone calls to the parents, because we'll actually be asking your permission, if you haven't consented to get your child tested, to get your permission. And then we will do this pilot, and then we're going to continue to just build on it throughout the holidays, so that hopefully by the time we get to Christmas, with the combination of vaccinations and this effort, we minimize the need to quarantine.
Good. Kevin R. on Twitter is saying, can we hold vaccination drives in our elementary schools once the vaccine has been authorized for ages 5 and up? It would go a long way if families can get the shot at school.
So I definitely am a supporter of that, and so we are building capacity. But as Dr. Awadi said earlier, I know my own children, 5 to 11. When my son is 11, my daughter is 5. My wife can't wait to get them their vaccines. They're going to want my wife there, and my wife is going to do it with our pediatrician, Dr. Sky. So, I think for some families, definitely a school site could be the best effort, and we'll make those accessible. Dr. Awadi, as you said, I just know myself personally, when you have a pediatrician you trust, it tends to be the best place for any of our parents.
Yeah.
Because there's other medical needs your children might have, because my children have allergies. And so, it's just another thing for us to think about as parents.
Yeah, absolutely. And Kevin, to your point, can we hold vaccination drives in the elementary schools? That actually is part of what's happening, right? So in addition to there being, there's 4 larger sites that CPS has set up. There's about 15 or 16 actual clinics within schools that are, broadly offering vaccine, including to families. But in addition, CPS already has scheduled more than 80 2-visit stops for the first dose and the second dose at the schools all across the whole city, and that'll be, that's sort of on an individual school basis. Like, we'll have it available at X school. You can, the parents can come if that makes sense. So, yeah, I mean, we're really trying to do everything we can, including working through school, to have that be possible. One of the things is, and we want, there are some parents who very much, or guardians who want to be with the kids, some perhaps not. And cps.edu/vaccinations is where all that info is, where those are being held. Tons and tons and tons. In the same way you saw us do a lot of community-based vaccination events for adults, that is still continuing, but schools for children become sort of a lot of that focus, because so much, so many families kind of activities can revolve around that. So yeah, thanks for that suggestion. Alexandria Deanne on Facebook. What are your thoughts on bringing a kid to visit Santa in person? Will one vaccine dose be enough to make that safe? So good question. I think certainly my guess is that Santas are getting tested for COVID, if you know what I mean. I would guess that Santas are, they're being extra careful, and certainly I'm sure any of the larger stores would be doing that also. If we're indoors for younger kids, there would be masks, but otherwise I think, if your child is over 5, even with that first vaccine dose, you do already start to get some protection. I want to be clear, you need both doses, though, for Pfizer to really be considered to have that full dose. But you've got some time. If you were to sort of start getting vaccinated in the next week or so, and you can get both of those doses in, you'd be in that last 2-week window, depending on timing. I think it's going to be lovely for kids to be able to be doing, some of those activities that were just really, really hard to do last year, and a lot of attention on keeping it just as safe as possible. So, good question. Okay, Mary Fitzgerald Miller on Facebook says, is it true that the federal government is giving schools money to enforce obedience masks on children?
So, so we have federal funds to support our schools just to be able to reopen for in-person. There's nothing that's specifically required. Really that, we work with our Department of Health here in the city to really, for best practices around safety procedures, and we've been following those safety procedures. There's also an Illinois state mandate around masking. Those are, again, just safety procedures, but it's not tied directly to any federal funding.
That's right, thanks. And I would just push back a little bit. This term obedience mask I find very strange. Those masks are a recommendation, and at all levels, the CDC, et cetera, they are part of what keep our kids safe in school, particularly when they've not yet had a chance to be vaccinated. But there is no, I'll just echo that, there is no funding that is specifically tied to that in any case. All right. Dee Ruiz, here's one for me from Facebook. I am fully vaccinated since April with no medical conditions. When can I get a booster shot? So Dee, I don't know which vaccine you got, and I don't know how old you are, but if it's since April, that is more than 6 months ago. So by time, you are eligible for any of those vaccines, and you can get a booster shot right now. There's a little bit, this is where we sort of said, you should, if you're over 50 and have an underlying medical condition, or over 65. In that younger 18 plus group, you may get it with an underlying condition, or if you're in any sort of higher risk setting. I would say, if you're particularly nervous about this, I don't know, what's making you particularly worried there. But if you're concerned about it, you're concerned about exposure to COVID, go ahead and get a booster. We've got plenty available. And no one is going to, you don't have to bring a note from the doctor signing off, I have this condition, I have that condition. So I would encourage you, if you're feeling like you're in a setting where a booster would be helpful, to go ahead and do it. Nobody under 18 though gets a booster, okay? This is for adults, and really it's most important for older adults, because breakthroughs remain pretty rare. 99% still no breakthrough, but where we do see them, it tends to be people who are older with underlying conditions. Okay. All right. Okay, here's a good question. My child had COVID recently. Should they still get the vaccine? So, yes. Let's sort of break this apart a little bit. Yeah. So, if your child had COVID and they have recovered from COVID, hopefully they're totally recovered. Most of the time, that's what we see happen. Occasionally, we see kids have real problems with inflammation or longer COVID, but most of the time they recover and they're fine. They would certainly have some protective antibodies after recovering from COVID. We expect that those antibodies are generally protective for about 3 months. We're pretty confident after somebody has recovered that in those 3 months after they've recovered from natural COVID, they are very unlikely to sort of get exposed to COVID at that time. That said, and you've heard me say this over and over again, in terms of sort of levels of protection, the very best protection, kids, adults, anybody, this is some of the best research out there, people who have both had a vaccine and recovered from COVID infection. That works on sort of different parts of the immune system, different cells, where they've done studies even looking at bone marrows. That is really the best, that combination. Next would be people who are fully vaccinated but have not recovered from COVID, which is most of us. Next would be people who are not vaccinated but have recovered from COVID. There is certainly some protection there. And then lowest are people who have neither recovered from COVID nor had a vaccine. And so I would definitely recommend that your child get vaccinated. You do not need to wait after recovering from COVID. It's got to be at least the 10 days while your child was recovering and could be infectious, obviously. But you don't have to wait 3 months or anything. You can do it right away if you like. That's probably what I would do personally, just because I'm all about trying to get us past COVID. But if you did want to wait, I would wait 3 months and do it then. But yeah, please do. My recommendation would be to do that vaccine as well. Okay. Lynn Taylor has a question about Facebook from Facebook about why are we needing 4 shots? Why is the vaccine weak? So I addressed this in a ton of detail last week. If you look, that 4 is only for people with the moderate to severe immunocompromise. It's not actually, like we spent 15 minutes on this last week, so I would refer you back, and if you have additional questions, please take a look. But the vaccine is not weak. The vaccine continues to protect really, really well. And we get a lot of, why don't you pay attention to, quote, natural immunity? We do. I just told you that, the people I'm most worried about are still the more than 700,000 Chicagoans with no evidence of either prior infection or having gotten a vaccine. But what we've seen is with the new variants that are coming, if somebody had COVID a very long time ago, and then there's a lot of difference in terms of how sick somebody gets from COVID, how good their immune response is. There are some people who get COVID actually never develop antibodies, right? And so in terms of having, and there's no level of antibody that an individual can check at this point that says, yes, I'm protected, or no, I'm not. It's called a titer. We talked about this last week too. Okay. So Kathy Powers is chiming in with a number of questions here on Facebook, saying many of our parents do not have pediatricians or pharmacies. Any comments about them getting vaccinated?
No, absolutely. Well, and like I said, what's great about our partnerships and our school-based clinics, they're actually health providers. So for example, Alivio, who partners with us in the Pilsen neighborhood, and really the goal for those providers is to make a relationship with the family. So please use our school-based clinics, and they will have vaccine available. And if you go on our website, you can see hours and availability. But I think, all of us have to encourage all of our parents to have some connection to a pediatrician.
Yep, good. And Kathy Powers on Facebook, just a follow-up, can a person who had J&J get a different kind of booster? Yes, we talked about this last week too. In fact, if you got J&J, the best protection, remember, J&J is 1 shot. So I saw somebody in clinic last night who still is not vaccinated, remains really hesitant about it, very worried about side effects, the whole thing. He's like, I'm only going to get 1. I was like, get a Johnson & Johnson. I continue to recommend if somebody is only going to get 1 shot, that's the one you're going to get. 1 shot of J&J, better than 2 of Moderna, better than 2 of Pfizer. However, 2 of Moderna or 2 of Pfizer does have better protection than J&J. And so the recommendation for the booster around J&J is just taking it from a first shot to a second shot. And in the study, the best increase in antibody levels for people who had gotten J&J was for people who got either Moderna or Pfizer as the booster. So what I am telling people, it depends a little bit on your situation. If you chose J&J the first time because you were worried about side effects, there was a reason you really wanted to go for that, go ahead and get a booster of J&J, no problem. That's going to also really increase your protection. If you're like, I just want to get the best protection out there, I would go for a Moderna or Pfizer. I saw somebody in clinic last night who had gotten J&J back in April. He's been doing fine. I wrote him for a Pfizer booster. That's kind of the recommendation. Scooby Manny on Facebook, if I was vaccinated in Mexico, can I get the booster here? Yes, you can. No problem with that. You just got to come on in and get your booster. So your booster would get entered into the same electronic registry system that we've got here. Okay. We're getting close to time here. Can I just sort of, as you're thinking about your own children and their vaccination, like what kinds of questions are they asking, or what are you thinking about with that?
So I think, Dr. Arwady, what helped me the most was when you shared the fact that it was a smaller dose, because both of my children have allergies.
Yep.
And so for me, knowing that, and my children hate shots. I mean, they really do.
Yeah.
And so knowing that it's a smaller needle, a smaller dose, so we, this has been our biggest concern. It took us more than a year before we visited restaurants, during the COVID period. Yep. And our biggest fear was our children, because both my wife and I are vaccinated. Yeah. And so for me, I just know so many parents just have so many worries when you're traveling, when you're going out to eat, when you're going to the movies. So I'm just excited that
Yeah.
we're going to be able to get them vaccinated, and,
Yeah.
and we're hoping next week with our pediatrician.
Yeah, okay, very good. We will share when I'm back on Thursday some more detail around kind of tips for talking to younger children about vaccine. We
Yes.
know, where
Yeah.
children are worried about that. There's some information already on our website at chi.gov/COVIDvax if you want to see this, but I want to go through in some detail, sort of from the pediatrician
Yes.
standpoint, how to talk about it, how to make a plan, how to give them some choice in terms of when we're actually doing it. So we'll go into some more detail about that. I decided just for time not to focus on that today, but we'll do that on Thursday if you're interested. And there are actually a lot of tips. When you get trained as a pediatrician, you give a lot of vaccines to a lot of kids who are not totally sure about this. You just want to be honest with kids is really the main thing.
Right.
And in my own extended family, I've got a lot of kids in that 5 to 11-year-old group.
Yeah.
And they know what I do for a living, and they have been after me about when can they get their vaccine? When can they get their vaccine? Can they come to Chicago, the ones in Michigan, and get this vaccine? Because it's been, their parents, I think, there's this idea that we can do that after we can do that with a vaccine, we can do that with a vaccine.
Yes.
They're just, one of my nieces has got it in her head that as soon as she gets a vaccine, she's going to the water park, which is not happening in November, December. But
it's so true. The things that kids miss being able to do.
Yeah. So anyway, it really is exciting. The safety and efficacy data looks really good on this. That lower dose, as you say, I think is really appropriate. Should limit side effects and really be a critical step. We get that big group vaccinated. That's our last really big group.
Oh my goodness.
And the under fives, a few of you were asking. I think early next year we may see something, maybe for those 2 to 4-year-olds. But 5 to 11 is going to be probably our last really big push. And we want the family to do this. So mom, grandma, niece, nephew, neighbor, really using this as an opportunity as part of Protect Chicago 77. We want to really get in all 77 community areas. We're going to keep doing, my team is working like crazy to make sure that we're making this absolutely as available and answering questions around the clock. 312-746-4835 is the number you can call if you've got other questions about vaccines, you want to know where to get a booster, you've got questions about kids. We've got folks answering that 7 days a week. And obviously we'll continue to partner with CPS in particular. We're partnering with all the schools in Chicago, but CPS in particular, just making sure that those families get their questions answered and have the ability to vaccinate with confidence. So again, this is Pedro Martinez, in his second month as the CPS CEO. Thank you so much for joining. Anything else you wanted to end on?
Dr. Awadi, just thank you for your leadership.
Yeah.
I mean, to have a leader leading this effort in the city makes me feel better, not only as the leader of CPS, but also being a parent here.
Yeah, good. Thank you for that. I appreciate it. We will be back on Thursday. I expect we will talk in quite a bit more detail again about some of the nuts and bolts of pediatrics. And really, it's an exciting week here. I love that question about getting vaccinated in time for Santa. That's how I want you thinking about this, because it's protecting to let us be doing the things that we love with as little risk as possible. And I'm sorry that those little ones won't quite yet be able to do that. But like I said, maybe we'll do a little follow-up, make sure the Santas are getting tested around town. I'm pretty sure that'll be a CDPH policy recommendation. So on that note, in the early November here, please continue to be safe, continue to talk to folks about vaccine, and if you've got questions, lift them up. We love answering them. Thanks again so much for tuning in. We'll see you on Thursday.